Good day everyone, my name is Erin Grace D. Danyan from Lesson 212E. So now I'm going to demonstrate the parenteral administration. Parenteral administration is a medication through injection, and it is more absorbed quickly than oral medication and irretrievable injection. So there are three types of parenteral administration. The first one is intradermal injection. Second is intramuscular injection, and the third is subcutaneous injection. So now I'm going to demonstrate first is the intradermal injection. Intradermal injection is the administration of the drug into the dermis layer of the skin. So now I'm going to check the doctor's order to know what medication to give to the patient. Second is check the MAR or the medication administration record. It is a legal record of the drug administered to the patient. Next is check the medication against the MAR to make sure that the correct medication is being prepared. And now, follow the three checks. So the first check is when it is taken to the medication cart. Second is before withdrawing the medication. And the last one is after withdrawing the medication. This is to avoid error. And lastly, organize the equipment to save time and energy. So I have here a syringe, a forceps, aspirating needle, medication tray, a vial, a 70% alcohol solution, which is a cotton ball, and last one is a garbage bin. Perform hand hygiene to deter the spread of microorganisms and also observe for the other prevention infection procedures. Prepare for the medication vial for drug withdrawal. Mix solutions. If necessary, rotate the vial using the palms of the hand and do not shake it. Remove the protective cup or cleanse the rubber cup of the vial using the antiseptic swab by rubbing into a circular motion. And now for the withdrawal, attach the filter needle into the syringe. Make sure that the needle is firmly attached to the syringe. This is to avoid the needle to be fell down. Then remove the cup of the needle. Then withdraw into a syringe the amount of the air equal to the volume of the medication to be used. Then carefully insert the needle tip into the upright vial through the center of the rubber cup. This is to maintain the sterility of the needle. Then now inject the air into the vial, keeping the level of the needle above the surface of medication. Then now, withdraw the prescribed amount of medication. Invert the vial and ensure that the needle is below to the fluid level. Then now, remove the filter needle. Then throw it into the small garbage bin and place it the exact amount or the size of the needle into the syringe. Then put it into the medication tray. So now I'm going to demonstrate the intradermal injection. Intradermal injection is the administration of the medication into the dermis layer of the skin. So first is explain the procedure to the patient or explain to the patient about the medication. Good morning, ma'am. My name is Grace I'm your student nurse for today. May I see your wristband, ma'am? Please state your complete name, ma'am, and also your birthday.
I am Tanya Garcia, December 27, 2000.
Okay, thank you. So now, ma'am, I'm going to do the intradermal medication or injection. And when I'm entering the needle into your skin, you may feel slight pain. And also, ma'am, it will produce a blood. So is it okay to you, ma'am?
Yes.
Okay, thank you. And now, provide privacy to the patient to promote comfort. So as if I have done to providing my patient privacy. So now, select a site for the injection. And so I choose the forearm and avoid the site from the lesions and tenderness to prevent infection of the diseases. And now, apply a gloves for the agency protocol. Now, cleanse the site of the injection. To dispose it out. So, for the preparing for the syringe, so remove the needle. Then expel the air. A small amount of air will not harm the tissue. Then after that, grasp the dominant hand. So with the non-dominant hand, insert the needle and stabilize it. This is to verify that the medication is entered into the dermis. And inject it with 45 degrees. And after that, remove quickly the needle and put the cap of the needle after. Then disregard it into the bin. So now, do not massage the area. This is to disperse the medication into the tissue. And also, disregard or remove the gloves. And after that, perform hand hygiene to deter the spread of microorganisms. After that, circle the injection with a black pen and do not use a red pen to avoid error. And after that, document all the relevant information such as the time, route, and the reaction of the patient, and evaluate the patient after 30 minutes and document the patient if she or he has a positive or negative skin test result. So now I'm going to demonstrate the intramuscular injection. Intramuscular injection is the injection of the muscle tissue. So check for the doctor's order to know what medication to give to the patient. Check the MAR, or the medication administration record. This is a legal record of the drug administered to the patient. Check the medication against the MAR to make sure that the correct medication is being prepared. Follow the 3 checks. First check is when it's taken to the medication cart. Second is before withdrawing the medication. Third is after withdrawing the medication. Lastly is organize the equipment to save time and energy. So now I have here a 5cc syringe, aspirating needle, forceps, medication tray, ampule, 70% alcohol solution, cotton ball, and also a sharps container. Perform hand hygiene to deter the spread of microorganisms and observe other prevention infection procedures. And now, prepare for the medication ampule for drug withdrawal. So, flex the upper stem of the ampule several times using the fingernails. Uses the ampule opener, place a piece of alcohol wipe between the thumb of the ampule neck. Then break it off by bending it toward me to make sure that the ampule is broken away from you and from others. This is to avoid injury. After that, dispose the top of the ampule. And now, for the withdrawal of medication, place the ampule in the flat surface. Attach the filter needle into the syringe. Then remove the cap of the needle. Insert the needle tip into the center of the ampule. Then do not touch the rim of the ampule. Single dose of ampule, hold it on its side. After that, remove the filter needle. And throw it in the sharp container and place it to another needle that correct to its size of the syringe. It's done.
Good
Good day everyone, my name is Grace T. Danyan from BEST 212E. So now I'm going to demonstrate the intramuscular injection. So first is check the doctor's order or the MAR. This is for the legal purposes of the drug administered for the patient. Second is check the label medication carefully against the MAR. This is to make sure that the correct medication is being prepared. Next is follow the three check, which are the medication within the medication card. Second is before withdrawing the medication, and the third is after withdrawing the medication. Next is organize the equipment to save time and energy. So I have here a gloves, a 5cc syringe, a gauze pad, and alcohol, 70% alcohol, antiseptic wipe, the alcohol for the hygiene, and also the garbage bin. So next is provide for client privacy for the comfort of the patient. So as if I am done providing my patient privacy. So next is prepare the client. So prior to performing the procedures, introduce yourself to the clients, verifies the client's identity using the agency protocol. So this is to know that you have the right client and also that you give to her the right medication. Good morning, ma'am. My name is Grace T. Danyan, your student nurse for today. May I see your wristband, ma'am? Please state your complete name and also your birth date.
My name is Risha Bautista. I'm born in February 16, 2003.
Okay, thank you. So assist the client to a supine or lateral prone or the sitting position, so depending on the chosen side. So if the target muscle is the gluteus medius or the ventricle side, have the client in the supine position, flex the knees. In the lateral position, flex the upper leg and the prone position. So in the toe in. So now obtain assistance in holding an uncooperative client. So explain the purpose of the medication and how it will help using the language that the client can understand. So include the relevant information about the effect of the medication. So ma'am, can you understand Bisaya or Tagalog, or you prefer English?
English.
Okay. So now ma'am, so this medication ma'am, I'm going to give you this. This is medication. It will inject you in your deltoid, which is the muscle tissue. So this, for example ma'am, the vaccine, so it will help you to protect you from any virus. So select or locate and cleanse the site. So I choose the deltoid. So next is I'm going to cleanse it. So next is select a site that free from lesions, tenderness, swelling. This is to because those conditions can hinder the medication absorption quickly. So if the injection are to be frequent, alternate sites. Avoid using the same site twice in a row. So locate the exact site for the injection. So apply a clean glove. So I'm going to apply a gloves now. So next is clean the site with an antiseptic swab. So I'm done cleansing the site. Then I use it for the circular motion and transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for the needle withdraw or the position of the swab on the client's skin above the intended site. So prepare for the syringe for the injection. So remove the syringe or the needle cap of the syringe. Then disregard without contaminating the needle
If using the pre-filled needle, unit dose medication, take caution to avoid dripping. So medication on the needle prior to the injection. So if this does occur, wipe the medication off needle with the sterile gauze. So inject the medication using the Z-track technique. So uses the ulnar side of the non-dominant hand to pull the skin approximately from 2.5 centimeter or 1 inch to the side. So under some circumstances, such as for the emaciated client, for an infant, and the muscle may be pinched. So holding the syringe between the thumb and forefingers, so as if holding a pen. So as if you're holding a pen. Then pierce for the skin quickly and smoothly at 90-degree angle. So hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back to the plunger with your dominant hand. So aspirate for 5 to 10 seconds. If blood does not appear, inject the medication steadily and slowly, approximately 10 cc or 10 seconds per ml, while holding the syringe steady if using the ventricular size. So after injection, wait 10 seconds if using the ventricular size. So and now I'm going to withdraw the needle smoothly for the same angle of insertion. So apply gentle pressure at the site with the dry sponge. So if not necessary, to massage the area at the site of injection. So if bleeding occurs, apply pressure with the dry sterile gauze until it stops. So activate the needle safety device or disregard the uncapped needle and attach the syringe into the proper septum. So now I'm going to inject this into the patient. So now I'm going to disregard it. So now I'm going to remove and disregard gloves and perform hand hygiene. So performing hand hygiene, this is to deter the spread of microorganism. So now I'm going to put it in the garbage bin, then perform hand hygiene. So document all the relevant information, the time of the administration, drug name, dose and route, and the client's reaction. And lastly, assess the effectiveness of the medication at the same time it is expected to act.
Now I'm going to demonstrate the subcutaneous injection. Subcutaneous injection is the injection underneath the skin. So first is perform hand hygiene to deter the spread of microorganisms. Next is provide privacy to the patient for the patient comfort. So as if I am done to providing my patient privacy. So now prepare the client, introduce yourself to the client and verify the client. This is for the verification that you have the right client, that you will give the right medication to her. Good morning, ma'am. My name is Grace Danyan, your student nurse today. May I see your wristband, ma'am? Please state your complete name, ma'am, and also your birthday. Okay, thank you. So now, ma'am, I'm going to demonstrate the subcutaneous injection. And now, assist the client so that the abdomen can be relaxed. This is to minimize discomfort. And also, assist for the obtain assistance for keeping or to prevent injury. Then after that, explain the procedure to the patient to know the patient what medication that you will give to her. So now, ma'am, I'm going to do the subcutaneous injection, which is I'm going to inject you into your abdomen. Is it okay to you, ma'am? And now, select a site and cleanse the site. And select a site that free from lesion, tenderness, and swelling because those conditions can hinder the absorption of medication. And now, apply a gloves for the agency protocol. place and hold the swab, for the swab is ready. So now prepare for the syringe. Remove the needle cup of the syringe because the needle cup will become contaminated if it is touching anything. And after that, for the injection medication, grabs the syringe and using the non-dominant hand, pinch it. So when the needle is inserted, move the non-dominant hand. So inject the medication by holding the syringe. So when you're holding the syringe, just imagine that you hold a dart. So this is to minimize discomfort. Then after that, remove the needle. Remove the needle smoothly. Then after that, this is to minimize client discomfort. So after that, if bleeding occur, apply some pressure with a dry sterile gauze. Now I'm going to put the needle cup after I use it and disregard it after. And now dispose of supplies and appropriately. This is to prevent injury from you and other healthcare workers. And after that, assist the client into appropriate position. And now do aftercare and disregard the glove. And after that, perform hand hygiene to deter the spread of microorganisms. So I'm going to dispose it into the garbage bin. And now assist for the effectiveness, document the time, route, and also the client reaction.